Hello, my name is Lieutenant Louis Luttrell with the Woodsville Fire Department, and I'm going to be speaking about the Woodsville Fire Department Community CPR and AED program. What is a community CPR and AED program? Uh, it's basically bringing CPR and AED skills and knowledge to the members of the community. Uh, we already have many places such as schools, our town office buildings, many of the places of businesses that already use AEDs, and it's going to make sure that their staff and people that use these places have the capabilities to use the AEDs and CPR if necessary. It also increases community readiness because we're going to have many people within the community that are able to um, have CPR and AED skills and be ready to use them in case they do need them. It also brings life-saving resources closer to the point of injury, which means CPR can be started a little bit quicker. What are the benefits of this program? Basically, early CPR and AED start prior to our arrival. When you look at AHA and they talk about the cardiac chain of survival, early CPR, early AED use is one of the main things that increases survival of patients who experience a cardiac arrest event. More people in the community are going to be trained to help. Therefore, we may be able to utilize some of these people who have been trained to help us on scene by doing compressions if need be, to integrate them into our cardiac arrest management. It also helps us do our job better. If we have more people that are trained and understand what we do or are able to help, we can always do our job better, especially with cardiac arrest events. What does the program look like? Basically, you have two groups. You have groups that already have existing AEDs in place at their place of business or school, and you have people that do not have AEDs in place. So let's talk about the people who already have existing AEDs. Basically, what we're going to do is give them the AHA Heart Saver CPR AED program. And what that is going to do is certify them to use CPR and AED effectively within their place of business and make sure that a lot of their employees have this training so that they can use it. Also, we'd like to do some sort of annual training after that just to make sure that they stay up to date on their skills, basically. They do have to recert every couple years, but doing training every once in a while can always benefit them since they're not going to be using it as often as we would in our profession. Then you also have the group who do not have AEDs in place. Basically, what we would give them is AHA all hands CPR. So basically, starting CPR early and continuing to do CPR until an AED gets on scene or more help comes to the scene. What we can do for these people is also give them resources to help purchase AEDs or grant programs that will help help these businesses and people get AEDs for their programs. Also, I'd like to do annual training with them as well for the same reason, just to keep their skills up and make sure that they don't get rusty because they're probably not going to be using it anywhere near as much as we do. So what's the implementation going to look like? We're going to start with the schools and other bigger facilities in our area. They already have the AEDs in place. Some of them already have people that are trained. We want to make sure that they have enough staff and members of the community trained so that they can use the AEDs that are there already. We need to market the program to those businesses and schools and also to the public. And what we can do is we can make CPR programs open to the public. So we give community CPR classes and AED classes, things along those lines, so that people who necessarily aren't affiliated with the schools or the larger businesses in our town the chance to learn CPR and be a chain, a link in the chain of survival. We already have the training and equipment, and instructors for this. We have 5 members of our department that are CPR instructors. We have a full set of CPR mannequins and 2 AED trainers. So with all this taken in mind, cost to the department is minimal to none. We can do this during training time, during so that we're not having such a greater impact on salary and time for the firefighters and paramedics to teach this outside of their regularly scheduled hours. But definitely, we do not have to go out and spend $3,000, $4,000, $5,000 in AED trainers because we already have them here at the station. Why do we need it? Within our community in the past year, we've had 25 cardiac arrest incidents. And one of those cardiac arrest incidents was a pediatric cardiac arrest. According to the AHA, 350,000 people suffer out of hospital cardiac arrest every year. So that's not taking into account the ones that happen in hospital. This is just looking at the out of hospital aspect of cardiac arrest. What else does AHA talk about is early CPR, early defibrillation. It's part of their chain of survival for cardiac arrest events, and it's been proven to save lives. The quicker we get these capabilities to the patients that need it, the more likely they are to survive the cardiac arrest event. So in conclusion, Woodsville Fire Department's community CPR AED program is needed within the community. It's something that's going to benefit the community as a whole, and those benefits necessarily outweigh any risks, such as having people, community members basically panic or things along those lines. You have many people within the community that are able to do this and hopefully be able to use it correctly with enough training. It's minimal cost to the department. Again, like we said, we already have the resources available to implement this program without having to purchase anything additional. And it's going to make our community ready along the aspects of cardiac related events. Thank you for taking the time to listen to me. Again, my name is Louis Luttrell, Lieutenant from Woodsville Fire Department, and I appreciate you guys listening.